Hello.
Yes, Missy with Bobby Harris.
This is
Hi, this is Donna Orr, Risk Manager with Honor Health. How are you?
good. How are you?
Can you hear me?
Yes.
Okay. This is Donna with Honor Health Risk Management Department. Is now a good time for you to talk?
Yeah.
Okay. Well, I was just giving you a call. I saw your email. It was forwarded to me. So I'm just calling to get some more information regarding your concerns about your cure and treatment that you received from Honor Health.
Okay. I can. I'm trying to think. My first email. I mean, I don't know what all you want to know. Like how much in depth you really would like me to go into.
Mhm. Well, you can share as much as you like. That's fine. I'll just take some notes so that I can refer as I'm, reviewing your chart.
Okay. Well, I was in a motor vehicle accident. That's what led me to John C. Lincoln.
Okay, when was that?
November 28th, 2016.
16?
Correct.
Okay.
I had open tib fib fracture, a right hip fracture, every rib, multiple places. My L1, L2, T8, T9, my collarbone. I tore my aorta 6 times, and my wrist was broken.
Oh, wow.
Dr. Miller, I had an ortho team, a trauma team, and then a plastic surgeon team. Dr. Miller's team tried to repair my ankle. I had staples in it, and then I guess I started getting necrotic tissue around it. And that's when Pritchard got involved and decided to do a muscle flap on it, a muscle stir flap. And when he did that, it was under, strict orders. Nobody was to do a dressing change except for him or his team.
And who gave that order?
Dr. Pritchard.
Dr. Pritchard?
Mm-hmm.
Okay. And, okay, hold on. Who tried to repair your ankle? Was that Dr. Pritchard?
Dr. Miller.
Dr. Miller. Okay.
And I was walking before I left Honor Health. I left Honor Health on January 7th. But even the day before that, before the 7th, my sister had came and seen me at the hospital, and my bandage had, it was oozing stuff out of it. Pritchard had been called, correct me if I'm wrong, I want to say from noon. They had kept paging him to go take a look at the dressing because it was under his orders. Nobody was to change it. He didn't even answer those pages until the next day, like at 11:30 in the afternoon. My sister asked a dressing change to be done before I went to the nursing home that I was going to because I was on IV antibiotics. Not exactly sure who did it. I have pictures of it. Some employee, it wasn't Pritchard, when they were doing a dressing change, she had her personal cell phone out. She proceeded to take pictures, never changed her gloves. I went to the nursing home. Even the nursing home staff called Dr. Pritchard and, asked if they could change it. There was a foul odor coming from it. My mother would come and get me from the nursing home and take me to Pritchard's office to do dressing changes. I actually went to 2 of them. One on the 21st in his office, and the other one was on the 29th.
Mm-hmm.
On the 29th, he decided to do a debridement on it. So we got a hotel the next morning, went back to John C. Lincoln to do the debridement. I came out of surgery from the debridement. He told me, my mother, and my sister to go to Scottsdale and Osborne, and that Dr. Miller and his team would be waiting for us. He said, don't make any other stops, go directly there.
Mm-hmm.
So we did. And then when we got there, we went to the ER, and then it was told to us that I received 2 new infections, and that they were going to have to amputate.
And where did they do that?
It's Scottsdale and Osborne. And these 2 infections, you can only get the one through cross-contamination. And I found out that Honor Health actually was doing a study on this infection at the same time. I don't know. Like, I'm at a loss for words. Like, I used to work in the healthcare field, okay? I know we're all humans. I know mistakes happen. But
now, tell me about the study. You said that Honor Health was doing a study?
yes.
Okay, tell me about that. And how did you come about that information?
I did research on it. It's on the internet. At this moment right now, I can't tell you I don't have my paperwork with me.
Now, what type of infection was it?
It's called E. coli. It's also known as CRE. It's rare. It comes from fecal matter. You have a 40% chance of living through it. It is resistant to every antibiotic there is. In 2017, when I received this infection, the CDC reported that 111 people in Arizona had contracted it. That's out of 7 million. And then after my amputation, I went back for a revision the end of March, because my body just quit healing. Like it just said it was done. So they did a revision. He cut off the sides that weren't healing. Dr. Miller and Dr. Pritchard. And Dr. Pritchard asked to be in on the amputations. It wasn't that anybody needed him. He asked to close it up, which that I just find kind of strange. I don't know. And then a year later, my 1-year follow-up, I went to Dr. Miller at his office. My appointment with him was maybe 2 minutes long. He wouldn't even come in the room. I noticed my care changed with him when he told me he had to amputate. He wouldn't look at me anymore. It was strange. I went to a new orthopedic on February 14th, and that's when I was told that I would have to have another revision done because the amputation was done incorrectly. From the x-rays that this ortho took, he explained them to me. He explained that when you do an amputation, the bone is cut at a 45-degree angle, so it makes a spear shape. And that's in order to wrap the muscle around the bone so you have padding. Mine was cut at a 5 to 10-degree angle. I had no muscle around my bone. He said if I were to leave it like that, my bone would protrude through my skin eventually. while I was at Scottsdale and Osborne, I know through this infection that you're supposed to be quarantined until you get 3 clear blood tests that you don't have it anymore. I was never once quarantined. Not at all. Are you there?
Yes.
Okay.
I'm listening. Mm-hmm. So you weren't quarantined from the infection, is what you're saying, or from
Correct.
the amputation?
From the infection and the amputation either.
Mhm.
I mean, and I brought this to patient relations, and I spoke with Debbie Denton, and she told me right off the bat she couldn't answer any questions. So, that was kind of, I don't understand, why I would want to have a meeting with just her if she can't answer any of my questions. So, I actually emailed Gary Baker, and he emailed me back and said that he could set up a meeting between Debbie Denton and Christina Zimmerman. So I met with them. And
that's what you met with Christina, Debbie, and Gary?
No, Gary was not there. I just met with the 2 women, and I explained to them, what had happened. I showed them the pictures that I had, documentations from other physicians that I see now. And honestly, Christina Zimmerman was truly sincere. And, but she did explain to me, that it would have to also go to Scottsdale and Osborne to get reviewed because, it was 2 different hospitals. I said, okay. So, her and Debbie actually followed up with me the next day to see if Scottsdale and Osborne had called me. And I said, no, not yet. I haven't heard anything. And Debbie was kind of shocked because it was already in the afternoon. I want to say 12-ish. So she said, let me call over there and I will get back to you. She said,
why did they refer it to Scottsdale Osborne?
Because that's where my amputation was. Okay. And some of my concerns had to do with the amputation being done wrong. Which that made sense, And then she also verified, she said, Christina wanted me to let you know that she did go over your medical records and there is no documentation from that dressing change. I said, okay. I said, I couldn't find it either. She said, it was clearly done. You have pictures of it. And I said, yes, I do. So then I talked to Scottsdale and Osborne. I answered, their questions they had. And then I had gotten a letter from...
Can I stop you for a second here?
Mm-hmm.
You said you have pictures. What pictures are you referring to?
Pictures that I've taken.
Okay, of
the dressing change that was being done while your guys' employee was on her cell phone taking pictures of it. My sister is actually a RN. She was actually working in Sacramento at the time. So on her days when she wasn't in town, if they came in to do something, I would take pictures so she knew what was going on. Mm-hmm. That's why I have a lot of the pictures that I have. Are you still there?
Yeah. Mm-hmm.
Okay.
Okay. So what is it that you were I know you sent the email recently. So what were you looking for at this time? How can I help you?
What do you? I don't understand what you mean. Like,
Right. So you sent the email to Gary Baker, I believe.
right.
Just
I
recently.
sent it to Gary Baker and I sent it to
Mhm.
Todd Laporte.
Mhm. And so what is it that we can help you with now?
Okay, well,
That's what I was. Mhm.
you didn't let me finish for one. Okay, so I got a letter from John C. Lincoln stating that I could find the name of the physician or the practitioner who did my dressing change on page 6,000 something. My medical records don't go up that far, so that's just a bold-faced lie. Second, I got another letter stating that the documentation from Dr. Pritchard, you guys, Honor Health, has a bylaw stating that medical records need to be signed off on within 24 hours. There was over a month where he never signed off on stuff. Continuously. And then I get a check from Honor Health in the amount of $13.15. I called to inquire about it because I had access at the time. So nothing should have been a repayment. And almost 2 years later, I don't find it a coincidence. I get a phone call back stating that it was supposed to go to Social Security because they sent for my medical records in December. Which, that I just find is a joke because I got denied for Social Security because I didn't sign a paper for them to get medical records. But I could go ahead and cash that check. Like, I find it extremely insulting. And, like, for your guys' CEO to know that a patient who has so many concerns is having a meeting and doesn't even bother to follow up, I mean, I just find that a bit ridiculous.
Checking something. You check the check.
Yeah.
So conveniently.
And how much was the check?
$13.15, which you guys charge $1 per page for the first 25 pages. Okay, I have 2,400 pages of medical records. So $13.15, what 13 pages did Social Security get? Because they have no record of even sending anything for my medical records.
Did you pay out of pocket for the medical records?
No, I didn't. Nope. I mean, and I find it no coincidence that, all these 3 letters, well, 2 letters and the check came within 2 weeks apart.
After your meeting.
After my meeting with them. Like,
3 weeks.
I don't know if that's your guys' law team trying to be slick or something, or how many other people have fallen for this, but I've done my research, okay? I'm not going at this, blindly or, just pointing fingers and, making accusations. Like, I've done hours and hours of research. I've spent hours of reading through my medical records. Like, is it about money with me? No, it's not. Because if it was, I would go get a lawyer and I would just take you guys directly to court. It's not about the money. Do I feel like I need some type of compensation? Absolutely. Like, my life will never be the same. Never. I was walking before I left John C. Lincoln. I mean, and for them to, say, oh, well, you left here and you went here, so it could have happened there. Nobody changed that dressing except for Dr. Pritchard. And then, mysteriously, I get some infection. Somebody does a dressing change, and nobody knows who she is? I mean, that's a little sickening if you ask me. I know of 2 other individuals that were at the hospital, John C. Lincoln, with the same doctors. that had devastating outcomes as well. I don't find it any type of, I don't know. I don't even know what to call it. Like, I know that John C. Lincoln got their funding cut because of their infection rate. I know every hospital has infections. But to just, try to sweep this under the carpet, like, I brought it to you guys so you guys could fix the problem. Not to try to insult me.
And what type of, you mentioned compensation. What type of compensation were you looking for?
Honestly, could you put a number, a price tag on your leg where you were young? I'll never be able to really play with my grandkids. Like, I just had to have another surgery to fix what they messed up. I mean, nobody should have to go through that. Nobody. And that's not even talking about, the other stuff that happened there. My sister is the one who gave me my first shower there. I had a bald spot on the back of my head. I would try to get up and go to the bathroom on my own. I would get told, can you hurry up? I don't have time for this. Like, you guys pride yourself in integrity and patience and where? Because I never saw it, not once. And I have documentation from other patients who feel the same way. Like, my life will never be the same. My oldest graduated. Yeah, I walked into her graduation because that was my goal. I didn't walk out. My youngest is getting ready to graduate. She's going to college. I can't even go walk the campus with her. So, and you expect me to put a number on compensation? Like, who does that? Do I want you guys to do what's right? Absolutely. Can I tell you what that is? No, I can't.
Well, I mean, I totally understand what you're saying, but unfortunately, I wouldn't be able to put a price on that. So, and I understand what you're saying, but if you wanted compensation, then you would have to tell me what you're looking for in compensation. I can't say that that's what we're doing, but I would just need to know what you're looking for.
Okay, I haven't worked in 2 years. I can't go back to work for quite some time.
If at all.
I mean, and that's if at all. I can wear my prosthetic for maybe an hour a day. Okay, and that's not just from, the amputation. That's from, my other hip and, being off of it for so long.
You made $63,000 a year.
I was a restaurant manager before my accident. I made around $63,000 a year. That's without bonuses. I mean,
Take that till retirement.
yeah. I mean, I don't think $350,000 is a lot to ask for. I mean, my kids' lives are not even the same, and they never will be. You know, when all this happened, my youngest daughter ran away. And, you know, she's basing her future on my lifestyle now because she knows I can never live by myself. I can't do anything. She has a full ride to go to Cleveland State University for nursing. You know, and it's like I was walking, and then I get the news that they have to amputate. So I go through that. And then I try to get back on my feet. I try to start walking again. And then I find out they have to amputate more. Like, I don't know how many other surgeries there's going to be. There's no telling.
Can you tell me about you said that you were in a motor vehicle accident?
Yes.
That was in November of 2016.
Mhm. In which my daughters found out from your staff about the other driver, which is a huge, I know ERs are small, okay? I know it's a small area. People are going to hear certain stuff. Mm-hmm. But the details that my daughters heard about the other driver were a little bit upsetting. And they know details that they shouldn't have, that the police don't even know. Okay?
And what was that? Mm-hmm.
That the other driver was drunk. I don't remember exactly what the blood level was that they said. At the time I had a CPS caseworker. She was also informed of that information from your workers.
So you had a CPS caseworker at the time of the accident, like before the accident or after the accident?
She actually closed my case the day of the accident. And I have a recording of her verifying everything that my daughters, told me. About the other driver, about the hospital staff. Yeah. Like I said, I didn't bring this to you guys, just on a whim or, just stuff that I might, I've thought long and hard and I've got all my ducks in a row. Because I do believe in human error.
Mm-hmm. So I have one other question for you real quick. So did you seek legal counsel for the accident?
No, I didn't. I had so much other mental stuff going on. Yeah. I mean, the other driver passed away due to blunt force trauma because he didn't have his seatbelt on. Another reason why I didn't go at that family losing somebody, you go through enough. My family was going through enough at the time. But I have one question for you, though.
Mhm.
So when I was in the meeting with Christina and Debbie, I asked them about Dr. Pritchard because when you look Dr. Pritchard up, it says that he is chief of surgery at John C. Lincoln and the chief medical director at John C. Lincoln. Is that true to date, or?
I'm not. I mean, I'll be totally transparent with you. I'm not familiar with Dr. Pritchard. I would have to look that up. I can't answer that question because I honestly I don't know.
Okay.
Okay. Was there anything else that you wanted to share?
I mean, the list can go on and on and on. I mean, it's just like going through this. Like, I relive this every day. Like, it takes a toll on you. I was a very strong, independent, single mom for years. I mean, and then going from that to not being able to shower yourself, it's a bit humiliating. And then, like, when you first go through this and you have people that are supposed to be helping you just put you down more and more and more, like, it doesn't make it better.
Well, I will review your chart
Mhm.
and I'll follow up with you. Sorry. I'll review the chart and follow up with you.
Okay, when
There's a lot of information that you covered, throughout the conversation. So I would say at least 2 weeks.
okay.
And this is a good number for you?
Yeah, or I can give you another number as well. 1959.
Okay. All right. Well, thank you for taking the time to talk to me. Like I said, I will review the chart and then I'll follow up with you.
Okay.
All right. Thank you.
Thank you.